dah dapat vaksin pun dapat lagi COVID-19. Kenapa nak kena vaksin kan? That is what people need to understand. The role of the vaccine. Prevent, protect 100%, or if we ever get infected, it will just be at category 1 or category 2, prevent hospitalization, prevent admission, and prevent death. That is what we want to give, right? And this is important for all Malaysians to know this. So this is what happened. This is what people don't understand, right? If you ever get infected, it will just be at category 1 or 2. You don't need to get admitted. With this, ICU bed will be in full capacity if we ever achieve the herd immunity. But I have seen cases where professionals as well. So the professionals, the degree holders, the university graduates, still they get this information wrong, and somehow they believe in that, right? But again, this is the era we're living in. Everything is at your fingertips. Everyone is tired of this pandemic, and people are worried, the cases. Whatever happens, like say for AstraZeneca, the frequency of blood clot 4 in 1 million is very rare. It happens. But how truthful KKM to our citizen? When we have side effect, we need to tell. The patient needs to know, right? Even if it is rare, it needs to the patient need to know that information. So we never fabricate things. So what happened is that these anti-vax, they are very sort of like intelligent in using this current form of communication, the social media, WhatsApp, Facebook, Instagram, to really spread these rumors, right? The rumors, the false information of vaccine. We are actually in this era of everything is at your fingertips. So it could be of bad things or of good things. How do you use that? How do you utilize? Now, how do you filter whether that information is actually true or that information is actually false, right? And everything with regard to medicine, it has to be evidence-based, and we do not want to. Why would people? Vaccine has been proven previously to eradicate cases. We have cases of polio. We have not seen cases in polio. We have not seen cases of measles, but we do see cases of measles in the past few years because of the movement of anti-vax. We have cases of diphtheria because of the movement of anti-vax, and we have seen cases like this in such a way that if you refuse vaccine, you do not able to contain, or we do not able to maintain the herd immunity of that particular diseases, and when disease happens, it spread to the others. Right. Particularly those, especially per se, I would say the smart teh issues. Smart teh issue, particularly those pakcik-pakcik yang duduk di kampung. So those are the people, and we expect that to happen, because duduk kat kampung and dorang just baca whatever they have. Some of them do not have the capacity untuk search through the net pun kan, to see, to verify the knowledge is true or not. That is somewhat understood. People would get confused because of that matter. But yeah, being a doctor, death is inevitable, I would say. You've seen cases of death, but the thing with the current pandemic, especially if you're death due to ICU, no one is allowed to enter, right? Everything is through video call. Everything is through the video call. So it is sad. Personally, I have not been placed in ICU, but we have seen footage on that matter, right? Before the patient is being put into sleep, and before we intubate the patient. So basically, when you are in ICU, you are in a 50% chance whether you survive or you're going to be dead, right? So before you intubate the patient, before we put the patient into sleep, the patient somehow needs to meet the family members first, right? And it is very sad. It is depressing, because some of the patient, they have not seen the parent for quite some time, since the very beginning of this pandemic, I would say. So it's very sad to see this, and it's even more sad if that were to be your family members or your close friends. So basically, I'm a final year student, a candidate for Doctor of Public Health. I have completed my Masters in Public Health in 2018, and it is a requirement for me to complete the Doctor of Public Health study for another 3 years. So basically now I'm in my final year doing my thesis and at the same time doing my attachment at Health District Office. My wife is Dr. Fatina Bila binti Osman. She is 33 years old, medical officer from the Ministry of Health as well. And we are blessed to have one son, one Yusuf bin one Abdul Hannan. He is 1 year and 2 months old. Sometimes we see cases, with the patient does not really telling you the truth that they are positive. So we have seen cases like that. So we on that note, we become the close contacts. When we become the close contact, we need to get swabbed, to get tested for COVID, and putting our son at risk of contracting the disease. Even at the age of 1 year old, he has been swabbed for 4 times. First during that time happened when he was 3 months old, so very young. So he needs to get swabbed because he become the close contact of a positive case. So anyway, that needs to be done. We have seen cases of age less than 1 month, few days of age, positive COVID. So we cannot take that for granted. So we need to test our son. So yep, it is difficult to say you're being a doctor on that perspective, and on the other perspective, you're actually a parent. So it's actually quite difficult to see your son to get swabbed, both at the nasal and the throat. Of course, he cried during the first few seconds, but after that, he's okay. Particularly during this pandemic, when we see patients at CAC, the COVID Assessment Center, we will assess the patient, look at them physically, and ask for the history. If you have comorbidities, you are indicated to get admitted. This one particular patient his weight is 150 with a BMI of more than 45. So if you are more than 30, you are obese. More than 30 BMI means you are at higher risk of getting severe COVID-19 infection. So those patients of high risk need to get admitted, right? So this patient, the whole family was positive. The whole family positive, the wife and the daughter. The wife and the daughter is not indicated for admission, so is allowed for home quarantine, but not for the father, for the husband. The husband has got BMI of more than 45. It was difficult times when I need to consult and convince the father that you are at higher risk. I know that you are okay now, but the thing with COVID, it could deteriorate very easily. The morning you are okay, at night or even in the evening, you suddenly deteriorate and then you collapse at home. That is what we want to prevent. And we have seen cases of people died at home. These are very unfortunate and it shouldn't be happening. So in this manner, we cannot afford to allow patient for home quarantine. And it took me almost 1 hour to counsel the patient and convince. And we have when we able to convince the patient and the patient admit to get it's okay. I mean he agree for admission, but then again during the process he called us, these doctors semua ni bodoh. So we have seen cases like that. Dia cakap like, I would rather die at home rather than die alone at the hospital. But the thing is that you are at higher risk. We want to prevent death. That's the main goal. We don't want, if you get admitted, the doctors are ready, the staff nurses, MA are ready to respond to you should you collapse, should you get collapse immediately. So that is what we want to prevent, because we are dealing with the patients with our own private numbers. They sort of like take advantage of of giving out our numbers to someone else. So that is quite difficult. Especially this is actually very it's a depressing, I would say. It is depressing, and it is sometimes you feel angry. Sometimes you feel you feel that you're being used for other reason. I mean, or for all you want to do is you want to make things easier for you and your patients, but somehow some of the patients, not many, just a little number of them, making advantage and use the advantage of getting your personal number and give your numbers to other people, you know, from other state to contact, to give. Suddenly your private phone numbers suddenly become a hotline for COVID, or not just COVID, even for anything else. And you have seen, and we have seen cases in which patient call us, my parent having shortness of breath, what do we do? I mean, all you need to do is you need to call 999, not to call the personal doctors. We cannot do anything. We just need to call the right number to respond to that. Even we have cases in which patient said that, doktor, saya ada sakit gigi, you know, 11 at night, or even WhatsApp you, saya ada sakit gigi, saya nak makan apa, you know, that kind of thing. When people take advantage of having that. With this current pandemic, it could happen to anyone, right? So we are all at risk. That's why the importance of getting your families to get vaccinated is important to prevent the disease or prevent the severity of the disease itself.